Today I had the opportunity to shadow in the OR at Lakeside. I'm just going to start answering the questions. So, in the pre-op area, the registered nurse is responsible for prepping the patient to get informed consent to give the CHG, administer any medications that are needed beforehand, and then they will also insert an IV. And I don't know if I've mentioned informed consent, but they get that. And then intra-op, they're responsible for bringing the patient back. They will position them. They will hold the mask for oxygen needs to help the anesthesiologist, and then they will prep the site. And then they also can help retract the tissue, and if they're certified, they can also sew up the surgical site. And then PACU, they're responsible for returning the patient to baseline, and they are also making sure that there's no complications, no bleeding. They monitor this incision, and they make sure the patient's comfortable by administering pain pills and anything like that. So the role of the circulating nurse is to get any supplies that the scrub tech or whoever prepped the room forgot, and then they will make sure that the timeout is done, that charting is done, and ensure that everyone is doing what they're supposed to do and ensure safety. This is an area that I would consider working in. The hours are great, and everyone seems super nice, and it seems like a pretty chill environment to work in. And then they protected the patients from harm by making sure that all the wheels were locked. Someone had their hand on them at all times on the bed. They're strapped in, and that all their bony provinces were padded. There was some policies and procedures to ensure safety, which I thought was interesting. They will write numbers on the bags, the trash bags, because if they lose an instrument or a sponge, they have to go and search those areas. So I thought that was interesting because I've never seen any other hospital do that. And then they use a wand also to find the sponges if they lose them in the body or anything like that. And then for the timeout, everyone participates. The circulating nurse calls it. She then will go through everything, and then the anesthesiologist will go through all of her stuff, and then the doctor will confirm, and the scrub tech will confirm. For the patient's rights, or privacy, they protected at all times. We're not discussing any of their information in a public area. They made sure that all of the charts they were using were taken with them. They didn't leave them in the patient's room or out in the open. They didn't respect the patient at all times on one of them. They actually were discussing her in quite a mean way. It was mostly the anesthesiologist because the circulating nurse didn't agree with it, but she also didn't advocate with it, so I never really saw anyone advocate for the patient this go around. And so the sponge count is where they count all the sponges prior to opening, during when they change surgical sites, when the legs come down, and at the end. They count them. The scrub tech counts them with the circulating nurse, and then they write the number down, and then they also use a wand to see if they're left in the body cavity. Report is given between pre-op to the operating room by the pre-op nurse, discussing all medications, where the IV is, what procedure, any allergies, things like that. And then from the operating room to the PACU, they will have the circulating nurse and the anesthesiologist go and talk to the PACU nurse about what happened during the surgery, is what the circulating nurse does. Any medications, any complications, where the surgical site is, things like that. And the anesthesiologist will actually start, and they'll talk about what type of anesthesia, what type of meds, if they're on room air now, or if, like, anything like that. And then for my nursing diagnosis, I'm gonna go with dysfunctional grieving process, because I had a young woman who had to have a double mastectomy because she had breast cancer, and I just thought, as a woman, that would be very hard for me to do, because you're so used to having breast, and that's what part of makes you a woman, type of thing. And I just think that would be very difficult for her to go through, and she didn't really discuss it, so I don't think she was grieving about her loss. She kind of just blew it under the rug. And then I learned from this experience that nurses can scrub in, and they do more than just retract tissue. I liked the whole experience. I actually saw a cyst remove that was the size of a grapefruit, and that was wild for me to see to come out of the body, and that was still the size of a grapefruit after they drained it to try to get it out of the hole. I didn't dislike anything. It was honestly the best surgery day for me.